have a dense sort of literature review or background section that lacks focus. And how you can address this, I actually created a guide, sort of a graphic that provides some, well, the introduction section of a scientific manuscript is pretty formulaic, actually. So I've created this graphic to give some guidance on how to develop or what elements should be included in the introduction section. You can see the shape is an upside-down triangle. In the introduction section, you start out very broadly, talking about sort of making an argument for why people should care about your research. This is sometimes called the so what. Then moving on to discuss what's already known about the topic, what's not known, that's sometimes referred to as the research gap, and then providing some justification why it's important to learn this new information, and then ending very specifically with your research question or your research objective. So one way that you can, once you have a strong draft, to kind of get a sense of whether you've included some of these important elements is to do what I call a reverse outline. So take a look at your draft, make notes in the margin. What are you doing in each one of these paragraphs? What arguments are you making? And then you can kind of check it against this graphic to see where you're at. In the second scenario, the introduction is a little bit too generic and it's not written specifically for the readers or the audience. So I really recommend that you start thinking about, and Dr. Chamberlain addressed this yesterday, is really to start thinking about which journal you're going to choose early rather than later, and then write to the readers of that journal. And so, as Dr. Chamberlain mentioned, you can just go right to the website, take a look, see who the readers are of a particular journal. Often, most of the time, you can pull up a journal, their website, and under About This Journal or Aims and Scope, you'll see a description of who the readers are of that journal. And so then you'll want to tailor the introduction and the rest of the paper to those readers. And two specific examples of ways in which you would want to tailor your writing. One very important way to tailor your introduction specifically is you'll need to think about what your readers already probably know and what they likely don't know. You want to be able to give enough background so that your readers will understand your research study. Another example of how you can tailor your paper is to think about who the readers are of the journal. So in this particular example, it's actually a lot of clinical people that read this journal, Maternal and Child Health Journal. So when you're providing your practical applications of what people can do with the information they learned in your paper, you should be really thinking about, well, okay, these people are clinical, they're clinicians, they're going to be working with patients, and then make your practical applications doable and relevant for that group of people who are actually reading your paper. In the third scenario, you have inadequate citations backing up the statements that you're making. I think this can be easy for us to kind of overlook as we create our drafts. We might not be thinking about adding citations. We're just thinking about making our arguments. So I suggest, of course, you should be citing all statements that could be, anything that could be argued, anything that someone might argue with you about, those statements should be cited. And this is an example here. The prevalence of cervical HPV infections has been found to be high among some sections of the Ghanaian population. And you can see this is the citation here. I suggest that once you have a strong draft in place, that you just go back and do a reread and just double check, be in the mindset of really thinking about citations specifically, just to double check that you have all the citations you need that are in place. Okay, so now I'm going to move on to research question pitfalls or challenges. So in this first scenario, have a vague research question or aim. And I'm including some key information that you can consider including in your research question or aim. And again, this is something I'm sure your research objectives go through many drafts and many iterations. But once you kind of have something you think is close to the final version, you can kind of go through and double check what information is included in that research question. So this is an example from the journal Contraception. The aim of this study was to estimate recent rates of unintended pregnancy among young unmarried women enlisted in the Israeli military and to identify variables associated with increased risk of unintended pregnancy among Israeli soldiers. So you can see here we have the independent variables, the dependent variable, information on the setting and population. We don't explicitly have mention of the study design, however, the word risk is used here, which implies a prospective design. In this question particularly, there's nothing on timing, but I would suggest you also think about including something about timing. For example, if it was a longitudinal study, was it done over 2 months or 20 years? Something along those lines. So you could review your research question. I suggest that you ask, I know you're all working with mentors, so they're all looking at your research questions, but you can also have a colleague look at your question with fresh eyes and really kind of give you some perspective on it. Another strategy for addressing or dealing with a vague research question or aim, I like to say that a reader should be able to read your research question or research objective and have some sense of what the analysis is going to look like. So for example, in this research aim, the aim of the current study was to examine the association of chronic kidney disease defined by glomerular filtration rate, albuminuria, or incident CVD and mortality in a multi-ethnic Asian cohort. So very generally, you see you have the exposures here and the outcomes. You could think of what the model is probably going to look like for the analysis for this paper. The outcome variables are going to be either CVD incidence or mortality. And on the exposure side, glomerular filtration rate or albuminuria. Okay, so I'm going to move on to some methods, challenges. One thing I see a lot when I'm reading papers is I read the methods section and there's information in there about what decisions were made, but there's really not enough information about why those decisions were made or justification for the choices that were made along the way, the analysis, why a particular analysis was chosen for a particular study. I really suggest that you justify everything that's in your methods section. In this example, it's an old paper from Walt Willett from 1990, but this is a great example of a justification for a decision that was made. For this analysis, women with a history of ulcerative colitis or familiar polyposis syndrome were also excluded because these conditions could affect eating behaviors as well as greatly increase the risk of colon cancer. So you see you have this magic word because, and anytime I see that word because in the methods section, I'm happy because I feel like I'm getting some information about why people made the decisions that they did. Another common thing to overlook in the methods section is methods section only describes part or one of the research aims. So this is kind of a detail, but it's something I see again and again just to make sure that your methods are complete. So this is an example. You may recognize one of the authors, Journal of Obstetrics and Gynecology. And I'm not going to read every word of this example, but here you have a research aim with 2 parts to it. And so the methods should describe both of these aims. And in fact, the methods section does describe both of these aims in this example. So once you have a complete draft, again, I would suggest that you just kind of go through and put this on your checklist and just make sure that really that all of your sections are consistent. The research question matches the methods. Everything described in the methods is presented in the results and discussed in the discussion as well. Some results pitfalls. Often I'll read papers, and sometimes in published papers, and the text is really focusing on statistical tests rather than describing the associations. So I'm suggesting, advising that you focus on the associations rather than the statistical tests. So in this example here from the Journal of Nutrition, Health, and Aging, you could see they're presenting some information, and there's sort of a list of beta coefficients. And I suggest avoiding these sort of lists of test statistics and instead really in words describe each association. So I have revised this text of something you might do instead. So for each 1 unit increase in BMI, a woman's fracture risk score decreased by 0.23 points. And I've just added the confidence interval rather than the p-value. It's a little bit more information. So then the focus of the sentence is the variables and the direction of the association. It's sometimes in the results section. In this scenario, the direction of the association is unclear, and I suggest that you be very explicit about the direction of an association. So in this example, higher maternal coffee intake was significantly associated with increased birth weight. Sometimes I think the writer can feel like the direction of the association is obvious, but even if it feels obvious to you, be very careful to spell out the direction of the association, that all of them that you're describing. In this scenario, the tables and figures are not complete. In this particular example, the title is not complete, so I would not consider this title to be complete. Again, I feel like as writers, often we're iteratively, creating these drafts, and we might just put something in as a placeholder and kind of forget to go back and really make it very precise. So the title tables, the titles and legends for tables and figures should really be very complete, including who, what, when, and where. So the results text should not repeat information in the tables and the figures. It should really summarize the main points rather than repeat. So this is an example of a table that's quite long and quite dense. And I thought this text did a nice example of summarizing information. There's a lot of information here. And so you could see in this example, they're saying in bivariate analysis, women with the longest treatment durations compared with others in their own treatment pathway were more likely to be Black, younger, have a lower income, be uninsured, or have Medicaid, be less educated, have a higher stage at diagnosis, and have HER2 positive disease. So it's a nice summary of a lot of information in the table. And of course, it's perfectly fine to point out key highlights of something that's very important that you do want to discuss. So focus on patterns and trends, highlighting only key findings from tables and figures. In the next example, talking about color, and color is something I think along with visuals that we don't really teach nearly enough about when we're talking about and teaching about scientific communication. And color can really be used to help convey the message, the main message of your figures in particular. In this particular example, this is an ordinal category that's being described here in this figure. And a couple of things, the colors are not easy to distinguish from one another. There's not enough contrast between the colors, but also with ordinal variables in particular. In this example, the best approach is really to use one color and graded shades going from light to dark. And we've seen some nice examples. I think of a chloropleth maps, Christina Baum and Dr. Fedwa, and I think today there was another map that really gave nice examples of these ordinal variables going from low to high. The eye naturally understands that to mean light to dark means low to high. So colors representing ordinal categories should go from light to dark, and colors should be easily distinguishable. Some discussion pitfalls. Someone had asked about discussion elements yesterday, so I threw this slide in. These are some elements you might consider including in your discussion section: recapping the main findings, discussing the significance of results and interpreting the meaning, comparing your results with other research, exploring pathways that might explain the results, strengths, limitations, impact and applications of research, suggestions for future work. I guess that was the last one. So pitfall number one in this scenario, the detailed results are repeated in the discussion, not necessary. Your discussion can really focus on the big picture. This is a good example of sort of the opener of the discussion. The results showed that the elevated concentrations of serum betaine and ratio of serum betaine to choline were associated with reduced risk of breast cancer. That's a nice summary of maybe your most important finding. And so definitely you should not be going into detail and repeating your results, and certainly you should not be including p-values in your discussion. One thing I think we all, most of us are, pretty clear about what the limitations are of our work and include those in the discussion section. I think that's really important. Where possible, I really want to emphasize that you include what you think the implication of your limitations are on your data and on your findings. That could be really informative for the reader. It's also really good for you to know this information. So without reading every word of this example, the first part acknowledges a particular limitation that was in this particular example. But then the second part is really specific about how they think this limitation impacted the results. So in this case, the authors felt that this limitation may have resulted in a potential overestimation of missed opportunities. It's not always possible to know this. But when you do think you have an idea about how the limitation may have played out in your study, it's really great to include that in the limitations and the discussion. In this next scenario, limitations are presented that may not have had a huge impact on the study, on the data, and on the findings. So I'm suggesting that if you have a limitation like that you recognize it could be a limitation in your data, but might not have been a very serious limitation, to make sure to point that out. I call this the acknowledge and defend strategy, because of course you want to acknowledge any kind of limitation that may have impacted your data. However, for the less serious limitations, you might take the time to explain why this limitation might not have been a huge flaw or a huge impact on your data. And it kind of goes with that previous slide about really understanding how each limitation is playing out in your study. So in this example, the first part acknowledges a limitation, which I won't read every word, but then the second part is where they defend that limitation. However, in our study population, this is unlikely to have been a major issue, and then go on to explain why. So again, this is going to really differ depending on every study, but it's something to consider as you're putting together your limitations section. This pitfall or challenge has to do, again, with being a little bit too generic. So often we see these generic statements in a research paper about future research as needed. So I suggest being as specific as possible, throughout your entire manuscript, but particularly with this part. This is a nice example, I think, of a specific recommendation about what the next step should be for a particular study. So these authors are saying, well-designed meta-analyses and systematic reviews of the current literature on prevention of IPH are needed. I suggest that you avoid the cliche, further research studies are needed, and be as specific as possible about what you think the next steps could be. You can also set yourself up. So if you've got a plan for the next step, you could kind of flesh that out in the discussion section, and then boom, there's your next paper. Dr. Chamberlain did address titles, and I thought he gave some great advice yesterday, and I'm just going to add to that. For in the situation where a title is not informative or is dull, really what Dr. Chamberlain said, and I echo this, is that your title should be an invitation for people to read your paper. Title is also used as an indexing tool, so it should be as informative as possible. It should identify the main topic of the paper. Suggest you avoid abbreviations unless they are very common, like DNA. Think about how someone would go and search for that article and try to get into that mindset. They're probably not going to put the abbreviation in the search box. Again, you want to capture the reader's interest. Your title will be read by thousands and fewer will read your entire paper. So this is just a summary, sort of a checklist for you as you go through each section. To look at the introduction guide and kind of think about the arguments you need to make in your introduction section. Be sure you're writing to a specific type of reader. Be sure you cite appropriately. Your research questions should be specific and informative. Justify each of your research methods. Describe methods for each one of your aims. Describe your results in words with directionality. Provide complete table titles and figure legends. Summarize key findings from your tables and figures rather than repeating. Use color thoughtfully. Don't repeat detailed results in your discussion. Include limitations and implications, defending your approaches where appropriate. And be specific about future steps. That's the end of my presentation. Thank you very much.